According to the Kenya Renal Association, cases of kidney disease is on the rise in Kenya, with at least 8,000 new cases reported annually. Figures indicate that 1 out of 10 Kenyans has some form of kidney disorder, translating to about 4 million people.
That is where the trouble starts for the community, where all these so-called lifestyle diseases, they ultimately boil down to the kidney and then land up in chronic kidney disease. And then you extend it, it will go to dialysis. You extend it a little bit more, go to transplantation. Each is costlier than the other.
Medical experts now say the poor diagnosis and lack of awareness on signs and risk of kidney disease is to blame.
This is one disease, even if it is severe and chronic, we have measures to prevent death, even if kidneys have failed. And people are afraid that they will be condemned to lifelong dialysis. Now that is where the fear starts. That is from where the question of how to prevent kidney disease is coming. And that is the reason the cost of supporting a dialysis program is immense on any government in the world.
With more dialysis centers and equipment set up across the country, more patients are able to access treatment. However, the cost of kidney disease treatment continues to keep away some patients. It is estimated that between 2,000 and 2,500 patients are on dialysis in the country, against 10,000 who have been diagnosed with end-stage kidney disease, referred to as kidney failure.
Make a patient live for 10 years on dialysis, average at least, it may take about 10 millions. So that is where both the common people, the families, the individuals and the governments, they are afraid how to support the whole program. So the only way through is to prevent the risk factor. You control the risk factor, you will prevent the disease, and then you prevent the complication.
Patients with kidney failure usually require about 3 sessions of dialysis, with each costing about 10,000 shillings. The National Hospital Insurance Fund, NHIF, pays at least 9,000 per patient per dialysis session and at least 500,000 for a kidney transplant at private hospitals.
Or if you have an option of somebody donating a kidney to you, transplant is a better option because you are back to your productivity. You are again contributing to yourself, your family and to the nation. Not just lying down on dialysis twice a week and then not doing anything. And then you become a burden to yourself, to the family and to the nation overall.
Outside the NHIF cover, hospitals charge up to 2 million shillings for each transplant, underlining the benefits of NHIF cover, especially for low-income households. Efforts by the national and county government to improve renal care has seen dialysis being done in major referral public hospitals in Nairobi, Mombasa, Kisumu and Eldoret. However, following cessation of movement and loss of livelihood due to COVID-19, the ability of some patients with kidney disease to access regular care and medications in some parts of the country have been severely restricted. Ben Chumba, reporting for Channel 1 News.